Nose surgery, or rhinoplasty, is one of the most common plastic surgery procedures. This procedure can help the patient to correct a structural deformity or a functional problem such as reduce or increase the size of the nose, correct the asymmetry of the nostrils, straighten the curvature of the nasal bridge, lift the tip of the nose, change the angle between the nose and upper lip, correct a birth defect or injury, relieve respiratory problems due to deviated septum. People who wish to have this surgery must be over 15 years of age, since this procedure can only be performed after the nose has reached its full development. It is not advisable for pregnant or lactating women, nor for people with coagulation and cardiovascular problems. The surgical procedure can last from 2 to 4 hours approximately. For a correct evaluation of the patient, the nose will be photographed previous to the surgery in 8 different angles, and the appearance the nose will have after surgery will be shown in 3D. Before the open rhinoplasty, the surgeon will clean the area with an antiseptic solution to eliminate bacteria and prevent an infection of the surgical wound. After this, the anesthetic, which can be local or general, will be administered. If local anesthesia is chosen, the patient will be given a sedative by means of an injection into the nasal tissues, which will numb the nose and the surrounding areas. Here, the patient will remain awake but drowsy, with the help of a medicine that will be administered through an IV. If general anesthesia is chosen, it will be administered to the patient through an IV or via inhalation through the use of gases or vapors through a mask or breathing tube. To begin the procedure, the surgeon will make 2 small incisions. The first will be in the columella, which is the tissue located between the nostrils and the base of the nose. Here, with the help of a surgical retractor that serves to separate edges such as tissue, the specialist will access the inside of the nose to then make a second incision that will extend from the columella to the interior of each nostril. With surgical scissors, the doctor will carefully separate the skin along the columella by pulling it upwards. Using surgical scissors and a series of retractors, the physician will continue to very carefully remove the skin from the underlying cartilage, which is the cartilage that extends from the nasal bones to the septal portion. Once the skin of the nose is detached from the nasal bone, the surgeon will be able to make the necessary corrections to the nose. Open rhinoplasty allows the doctor to better modify the nose in patients whose tip is wider or protruding. The specialist